Good evening, everyone. I'm Andrew Penn, one of the co-founders of Open Nurses. After that, it's always hard to follow that swelling introduction, but I want to introduce our colleague Taylor Flatt, who is a PhD student at The Ohio State University and a research assistant at the Center for Psychedelic Drug Research and Education. She's also a psychiatric mental health nurse practitioner at the Children's Hospital of Philadelphia. And Taylor is passionate about pediatric mental health and flourishing, and her research focus is on adolescent experiences with psychedelics, which I'm sure we'll get into tonight, as well as early parent-child relational health. She completed her bachelor's degree in nursing at the University of Virginia and her master's at the University of Pennsylvania. She has over 9 years of clinical experience working in pediatric psychiatry, spanning inpatient, outpatient, emergency, and medical settings. She's done it all. Taylor's recent leadership roles include serving as IPN's Director of Community, co-founder of the Penn Psychedelics Collaborative, which I think is where we maybe met at the University of Pennsylvania, and a member of the Board of Advisors for the Psychedelic Parenthood Community. Interested to learn more about that. In her free time, she enjoys practicing yoga, painting, spending time in nature, and dancing. So Taylor, let's get you on here. Hey, Taylor, nice to see you.
Hey, Andrew. It's great to see you too. Yeah. Thanks for having me.
Of course. PhD, now you've really gone and done it, haven't you?
I don't have it yet.
Where are you in that? We're in that process. Yeah, it's a long process. Where are you at with that?
I'm just starting next week, entering into my third year. So doing my candidacy exams this fall and all that stuff after that.
It's a journey for sure. Well, I mean, we got a little bit in your bio, but we always ask people, nursing and psychedelics is such an interesting combination. We're always interested in sort of how do people get here, and what brought you to this place, and what got you interested in this whole big topic of psychedelics.
Yeah. I feel like sometimes I can't even believe that I'm in this particular position, because I definitely, starting off, I did not think I was going to be in psychiatry at all. I said that was the only thing I didn't want to do in nursing school. I feel like that's always how it goes. But I guess, how far back to go?
I guess started when I was a young child.
Right. When I entered the world.
Yes.
I guess what really sort of was a catalyst point was, honestly, when I was in high school, I took a biology class, and was something about seeing evolutionary biology and the ingenuity of life to sort of navigate all these crazy things. I just thought that was so inspiring and so fascinating to see how different organisms have gone about different things and all that. And then when I was struggling with different health challenges, people in my life were struggling with health challenges, I thought it was really bizarre that, when it comes to mental health, that we just sort of couched it into this sort of maladaptive, and it sort of was almost this not a death sentence, but it was really sort of from what I understood at the time, it sort of sent you down a path that was could be pretty tough, at least, from those in my life. And I just thought that was really strange. Why can't we get through this, or why is this so sticky? So I think those two things at the same time really made me so interested in the human aspect of experience and in nursing, to be able to be with people as we were both confused, but also maybe me being less confused as the nurse than the person, but to sort of walk through this thing together, and to be able to explain sort of what's going on to people, and help with suffering that way. But it wasn't until I started, I did my psych clinical, and I was okay, shoot, this is cool. It's just so super weird. Someone's having a very different experience of reality than me. I'm sitting across from someone who's in a psychotic episode, and we are in the same room next to each other, and he is on a different plane than I am. Right now, that was just crazy. And I feel not having an explanation for that was really fascinating to me, but fascinating and and heartbreaking. I think it's sort of together, sort of put this in, instilled this into me to be like, I wonder, like, could we find out about that type of state, these altered states? And so then when I started working, my first job at the Johns Hopkins Children's Center, just like loved working with the kids, like, being there, as people were sort of getting to know themselves and childhood and adolescence being such a pivotal point. I felt like I was just like really was so struck by the fact that our current treatments could only do so much for these kids.
Yeah.
And sort of like seeing the same, sort of rotating door of people like coming in and they were doing everything that we told them to do. They went to the places we said that they should go, and it was just like nothing. And so I feel like I sort of started to open my mind up to like, what else is there? We're having these advancements in like every other thing, but I feel like in psychiatry, we still don't even know what's happening with a lot of these situations, and we're, there's little that we can do to help. And so my friend at the time, sorry, this is a long answer.
Oh, it's all good. We're just chatting here.
Yeah. My friend at the time was working at the Johns Hopkins Bayview Research Center, and I was like, oh, you can like make some extra money if you are a research participant. I was like, oh, cool. So I like went on to clinicaltrials.gov and found like a psilocybin for healthy participants, and I was like, what is psilocybin? And looked it up and just like went down the rabbit hole, and I'm honestly like still there, but I think it was just like mind blowing. But just to see the results of some of the early trials, that were coming out of Johns Hopkins, and psilocybin for depression, for existential distress, for all these things that we really have not seen in psychiatry, and since the advent of Prozac, and was just this question like lodged in my head, like, could we do this for these for this population? I don't know. And I sort of like tucked it away in the back of my head of like, oh, someone's gonna ask this, because like it feels like a slam dunk to me, like we're seeing
the pediatric treatment with psychedelics.
Like it'll get here eventually, like
and that was the thought you had back then, was like,
that
could
was
this
like
be used with children?
And then that day like never came. Like, I was sort of asking people, hey, is anyone researching this? I remember being with you at, and amongst a bunch of nurses, and was like, do you guys know anyone who is like asking this? And they're like, no. And it sort of dawned on me like, oh shoot, time to go find out.
and here you are many years later,
right.
Middle of grad school. And I mean, it is a provocative question, right? Like, because I mean, interestingly, naturalistically, not many, but there's a reasonable portion of young people that experiment, with psychedelics, and sometimes it goes great, and other times it's more challenging. Like, but as treatments, are you imagining that like these are things that could maybe change the sort of trajectory of a, because you always worry about a young person who's developing, say, depression or anxiety or something like that. Is it going to keep going? Is it going to, is this the start of a lifelong challenge that they're going to have, or, does it change?
Yeah. I feel like it's maybe too soon to say like how I think that like treatment could go, because I feel like there's like so many particularly like contextual factors that I feel like are really unique to this group, and neurobiologically and developmentally. But from even just talking to people, and I'm currently in the middle of doing a review paper on this topic to sort of see what's out there. People, as I brought this question up, talk about like, if they did psychedelics as an adolescent, it really having an enormous impact on their lives. And granted, most of the time I'm asking this at like psychedelic conferences. Like, I'm not just asking people at the grocery store, but, a lot of people saying, this is something, I saw something, I realized something, it like did something for me, and it made me realize like it sort of like invited me in, or it helped me shift my perspective on something. And it did alter my trajectory massively. So I think that's like sort of the question that, I mean, I feel like at this point in my like doctoral studies, I have more questions than answers. But one of
Sounds
them,
like you're exactly where you need to be, right?
right? But at this point, it's like, okay, we know that it's sort of like this, like, you know, like adolescents are like this like loaded spring, you know, like,
Hmm.
and there's all these coming of age rituals that happen during then, you know, it's this major transition period, but it's like, can psychedelics alter that trajectory for the better? And what does the better look like? You know, what are we aiming for anyway?
Hmm.
But from just anecdotally, like, yeah, it could definitely impact people's trajectory, like probably maybe more than adults potentially, just like also just thinking about like, you know, you have the ability to like, does it impact where you go to college or if you
Hmm.
go at all? Like, you know, major life pivotal points that I feel like at different phases there might be more stability.
Yeah. Yeah. Um, and yet most people, when they think about psychedelics in young people, immediately think about risk. You know,
Totally.
they think about the, you know, the kid who's having the proverbial bad trip and, you know, finds that traumatizing. um Reminded of at UCSF. So we have an art school in San Francisco, a high school that my son actually went to, but it's next to a big wooded canyon park in the middle of the city, which is kind of a delightful surprise. But the canyon, as it's known, is a place where sometimes kids go to ingest mind altering substances after school. And apparently this kid had taken mushrooms and had wound up somehow. I don't know exactly what happened that brought her to the attention of whoever intervened, but ended up in the emergency room at UCSF. And one of my colleagues was on call and went in there. And by the time she got there, apparently the kid was hugging both of her parents and saying how much she loved them.
Mm-hmm.
So it had gone from something terrifying to something, you know, really tender. Um, but it speaks to the challenges, right? You know, I mean, like, I often feel like you need to have a solid ego to withstand dissolving your ego. And
Mm-hmm.
teenagers don't, you know, they're kind of malleable, right? You know, adolescents,
Mm-hmm.
there's a malleability to them. And so how do you kind of walk that when you're thinking about, you know, if you, I mean, clearly you were well ahead of the curve because, you know, I mean, we haven't done any clinical trials that I know of psychedelics of people under the age of 18, but you know, I know the FDA wants that kind of stuff. You know, they want adolescent studies because it's a population that doesn't have a lot of treatments that are approved. Um, so how do you think about that sort of risk between, you know, something that might be overwhelming or something that could be really kind of beneficial with such, let's just say adolescents for the sake of this conversation? How do you think about that?
Mm-hmm. Before I forget this, I asked that same question to Bill Richards on a panel, and he said the same thing as you. You
Oh
have to
yeah.
have an ego to transcend an ego.
Maybe
Like,
I stole it from him. It's entirely possible. Most of my best lines are plagiarized.
no, no, but I think that that's like that's a really valid point of like, you know, if you know some of the strongest things that we're seeing in adult studies, you know, ego dissolution, transcendence, like, you know, if some of these sort of, I know, you know, a lot of mechanisms are still, you know, very much under investigation, but if some of these, you know, sort of like key mechanisms are sort of up for question in this group, then we're talking almost about a completely different process. You know, we're talking about a very different situation. We don't even know then what would be helpful potentially in this, you know, if it's not the things that we think it is.
Right.
Like, for example, like in, there's like a recent study that was, it was just like a naturalistic sort of like repeated cross-sectional study where they compared young adults and adults who'd use psychedelics, just like, you know, in their own sort of homes. And
Mhm.
The, I don't have like the exact stats in front of me, so don't quote me, but
Okay.
the article is called Psychological Effects of Psychedelics in Adolescence, I think.
Mhm.
And they found that the strength of the mystical experience was weakly negatively correlated with well-being outcomes in adolescence, which
Negatively correlated.
weakly
Interesting.
negatively correlated, but even that result in of itself is like, that's really interesting. This is one of the strongest predictors we have, So just a lot of questions, again, more questions than answers right now about like, well, why is that? Like, were these adolescents taking higher doses than adults? Are they more sensitive than adults? Is there less, preparation? If people are sort of like hiding it more, or maybe there aren't as many like harm reduction measures out there, that, all these other things. So, yeah, I think with adolescents, like in terms of, the example that you brought up, I heard something somewhere recently that was like the difference between a crisis and a process is time. And I think that's something that I'm curious to explore sort of like in this particular subject matter, just because like, in at least from working with like adolescents, there's a sort of a lability, going on with this group. And so I wonder if, and their parents showed up and they were able to like to express that, if this might look very different in terms of like how long this process will be, what different sort of environmental factors will be at play and for how long, versus like, when they go home, do they go home? What needs to sort of like be in place? Because it's not like you can, as an adolescent, alter your environment that much.
Right.
We might not even be able to drive at that point. So, yeah, so I'm not sure that answers your question, but but I think that we don't really have a great way of understanding what the adolescent sort of like ego readiness is right now, 100%. But there's definitely like so much variability in adolescents developmentally, in terms of maturity, ability in sort of different aspects of like intellect and whatnot. So it'd be hard to tell like, okay, if you need an ego to transcend an ego, and we don't really have a very clear way of determining that, then
yeah. I mean, you mentioned earlier also rite of passage, and that I've heard it said that our culture doesn't offer a lot of being kind of removed from a lot of tradition, that we don't have a lot of rites of passage. Some cultures do, obviously, but we have high school graduation, getting your driver's license, things like that. But this is for a lot of people, when you hear them talk about their own personal psychedelic experiences, it has that quality of like, there was a who you were before, and there was kind of how your world changed afterwards. Do you, in your clinical work, do you encounter that with young people that are using psychedelics naturalistically in the wild, if you will?
I'll preface this by saying that I work in an emergency department and in like the inpatient setting, so I feel like I'm not seeing the people who are like blissed out.
It's David Smith, who ran the Haight-Ashbury Free Clinic, used to call it the orthopedist in a ski resort problem. It's like, if you're an orthopedist in a ski resort, skiing looks like the most dangerous thing in the world, right? Because you only see the casualties, you don't see the people that had a good time, going home intact. So you see the people who are having a hard time.
Yeah, exactly. Yeah. So I feel like acknowledging my bias to that, but it seems like definitely when they're sort of coming out of it, even I don't really right now see too many kids come in with like psychedelic congestions. It's more so like cannabis, K2, that type of thing. But every once in a while we'll get sort of like a parent who thinks that they're having a psychotic episode, but really they just like took a ton of acid or like side tangent, it looks very similar, obviously, like, to someone on the outside. But I think from just like anecdotally, there's been a few cases that I've come across, and sort of like as they're coming out of it, they're definitely, if they do, usually, after a few days, You know, if we, administer an antipsychotic, or, if there's just like time and, sort of rest, they definitely, even in the cases of like K2, like there is a change there of like, I didn't realize that this could happen to me.
Mm-hmm.
Like, I feel like this sort of breach of I feel like a level of security that they were unaware of that they had in terms of like their mental state of like, I didn't realize that this could happen to me. I didn't realize I could get like this.
Mm-hmm.
And, what does that mean? I didn't, like any experience, like I didn't think that this was going to happen, but it did.
Mm-hmm.
And how to reconcile with what I thought was going to happen and what actually happened, which, has a lot of overlap with the Rebus model and all, in terms of like, what does this mean to me? What does this mean about the friends that I hang out with? Like they all love to like, do all the stuff. So it doesn't actually feel like too far out, like it's psychedelic only. I feel like I see this with a lot of sort of like of crisis points like this of
Mm-hmm.
like, I can't believe I'm here. I can't believe I'm in the emergency room. Like, how did this happen? And so there's definitely this sort of like point of no return, a little bit of like trying to make sense of something that was like really scary.
Yeah. And I can't help but wonder, perhaps you have some thoughts on this about, we have such a sort of a punitive way of looking at substance use mishaps, and I could definitely see a sort of a tone of like, well, see, that's what happens when you smoke that stuff, if you don't want that to happen again, you should never do that again,
Mm-hmm.
and how realistic is that message? Is there sort of a missed opportunity for harm reduction there? And is there, what if the person had both a difficult and a beautiful time? Like this young person who had the psilocybin situation in the ER, I mean, she obviously had some difficulty. That's why she ended up in the ER, but she also sounded like she was having a pretty beautiful moment with her family too. And so it's kind of like a both and, right?
Mm-hmm.
And how do we like not code this as like, well, you screwed up,
Right, right. Yeah. And I feel like definitely in our healthcare system, in like in emergency situations, it's like, how do we reduce this risk now? And
Mm-hmm.
it's like the way to reduce this risk the most is just never do it again. And to sort of, just be like, well, like that's, yeah, throw that in the weird drug experience box. And if you
Mm-hmm.
don't, and we can get rid of that box if you never do drugs ever again. Like,
Right.
but it's like, to your point, I feel like so much more nuanced than that of like, well, why were you doing it? And like, what actually happened? And, you know,
Yeah. Did you know you're not supposed to eat the whole chocolate bar?
did you read the instructions?
No, I didn't. I just ate the whole candy bar,
Yeah.
Um, I mean, so when you think about nursing in this, I mean, obviously we're a nursing organization, so we're always interested in this angle. I mean, is there a particular way that you go about this that you think, or that your fellow nurses bring to this that you think is maybe a little different than how our colleagues operate, or that they could learn from us about, does that make sense?
Hmm. Like our colleagues, like other disciplines, and
Yeah. I mean, I feel, the great thing about working on interdisciplinary teams is that, we hopefully learn from each other,
Mhm.
so what is it that you think our profession brings to these kind of tricky situations, that maybe is of use to our colleagues in other professions?
Hmm. Hmm. Honestly, I feel like I've been thinking a lot about this, like getting my PhD in nursing, and
Mhm.
wondering, what is the difference between a PhD in nursing versus a PhD in like many other things. And I don't know if I have I've fully answered that for myself, but something that has really come up for me in thinking about this is that I feel like nurses have such a groundedness in reality
Mhm.
of like, we are with the phenomena itself. We are with the patients themselves. This is not
Mhm.
this echo chamber, of like this textbook that has information from 13 years ago. Like, it's not he said, she said, asking from other people. It's like we are there with what's happening. And I think that that's something that, as in whether it's in research or in clinical trials or in in various different situations out in the wild.
Mm-hmm.
I feel like we bring sort of this groundedness of experience to different things, where I feel like we really do a good job at balancing, here's what's actually happening, and here's this whole, bank of like resources, knowledge, tools that I have at hand to sort of like meet this experience where it's at. And I feel like we were just like genuine artists in that way, that we were able to like really like meet the moment with like whatever it needs, and to sort of forget what we wish was going to happen or what we think is happening, and sort of be like there with it. So yeah.
Yeah, there is that synthesis of sort of book knowledge and the capacity for improvisation informed by our past experiences with patients, right? That I think, I mean, I remember like, that from novice to expert model that Patricia Benner came up with years ago about nursing education. It's kind of everywhere. She talked about that when you get to that expert level, you kind of do that without even realizing why you're doing it. At first you have to do everything very deliberately because you're not sure if you're doing it completely and right. So, you kind of follow the steps, right? And then you start doing it somewhat more automatically, but could still say why you're doing it. And then you get to a certain level, you're like, this is just how we do it,
Right. I don't know why, but
I don't know why. This is how I've always done it.
Yeah.
And actually then you have to like be very deliberate about like, how do I explain this to somebody who's learning this for the first time? Taylor, you mentioned getting PhD. And so, we nurses and our letters after our names, we sure love our letters. I sometimes joke that I knew I needed to go into a profession where I would get some letters after my name, so I could, have a profession and all that. So I chose the one that awarded the most letters, and that was nursing.
PMHNP BC.
Oh yeah, that's just the start of it. I don't even trot out all my letters because it's kind of ridiculous. But I mean, in all seriousness, so I hear nurses sometimes who have aspirations to wanting to do something more than like say bedside nursing, or even more than like advanced practice, roles. And they say, I think I'm gonna get a doctorate. I'm like, okay, well, why? And of course we have a DNP and a PhD. And so I'm hoping maybe you could kind of disentangle the difference between those two things, because I think a lot of people think if you get a doctorate, you do research, and then they're surprised. You're like, well, DNP actually isn't a research degree. So, I guess I'm curious, like, why you get a PhD? Like why would somebody get a PhD, and what's that process like for those who are not as familiar as you undoubtedly are at this point? 3 years into it.
Yeah.
Grumble.
No.
But yeah, could you walk us through that, if somebody out there is watching this and thinking, I think I'm gonna get a doctorate in nursing, like, what should they know?
Yeah. I think I guess first of all, like if I like to my like prior self, I feel like I sort of like had in my head, not that I'm doing this just to be like, oh, I'm gonna like, climb, but I feel like I wish I sort of like knew that I could like chill. Like you're valuable at every level. Like don't be chasing, like don't be so hungry for the next thing. It'll be there. Like, relax. But I think if people out there thinking about their grad school stuff, I feel like if you really have a question that is like in your mind that you just like you, for me, I sort of like, it came to me with something that I found myself like asking myself a lot. It was like I was reading books, articles, talking to people about it for fun. Like it really brought me a lot of joy. It still brings me so much joy. It's something that feels like this like endless fountain of like just like inspiration. If you have something that's like that, then this really actually do consider this as a career. Because like I know I was saying grumble, but like I feel like anything is worth it if you like acceptance and commitment. Do you think it's worthwhile? Does it give you the things? Does it give you more than it takes? And I think for me, what I love about this particular path, especially being a clinician researcher,
Mhm.
is you just get to like scratch all these itches. You get to be like in so many, you get to be so multifaceted, which I love.
Mhm.
Like
Mhm.
getting to like, read a ton about something that like you might be one of like I know I can count on my hand the number of people who are researching this. There's only a few people who are doing this. You can really
Mhm.
contribute knowledge to the world that like most people don't care about or
Mhm.
know how to do like or know it like you do. So
Mhm.
it's like satisfying in that realm. I love getting the opportunity to talk to people about things and to like I feel like it gives me this like I love to be able to contribute something to someone else's knowledge bank, if you're presenting at a
Mhm.
conference, but also like I feel like it's exponentially grown my admiration for other people's,
Mhm.
areas like I remember listening to like Elliot or not Elliot Marseille talk about like
Oh yeah.
economic models of like and I
Mhm.
just had no idea what he was talking about, but
Mhm.
it was like just like music to my ears because it was just like someone put so much thought into this and really cares so much, and it was just like so awesome. So yeah, I think if you have something that you really like, beyond just reading about it, you feel like this is something that you could really spend a ton of time on because it's a ton of time,
Mhm.
that you really want to orient your life around, and it's something that you really think could be a valuable contribution to the world, then this could be for you. Otherwise, join like an interest group, which is could also totally do it. Like, you could also not get a doctorate and still contribute. But
Yeah.
yeah,
Yeah. So you have to be professionally curious and deliberate. It sounds like it's not.
yeah.
Um,
I have this on my wall. This is oops. This is
Whoops.
my. This
Stay
is
curious. Love it.
yeah. That is my mom.
Yeah.
Yeah.
No, when I graduated a bazillion years ago, I remember feeling like I kind of left the table a little hungry still,
Mm.
and I was like actually grateful for it because it made me feel like I got to go look that up. I don't know. I encountered something today I didn't know about. I should go learn what that is right now while I'm still remembering it, while I'm still interested. And it was, yes, I think one of my preceptors gave me that advice once. It was like, when you get home every day, think about your day and what was something that you didn't understand and go look it up right
Hmm.
then and there because you'll never be more primed to learn and remember that, and like the one I always remember, I tell my students this is like, I think I was like 6 months out when I was like, is valproate and Depakote and Depakine and valproic acid all the same thing? And the answer is
Confusion.
yes. But like, I was like, are we talking about the same thing? It's like somehow I managed to get out of school and pass my boards and I didn't quite commit that to memory, but I learned it and I was like, yeah, they're just different formulations of the same thing.
Yeah,
But so it sounds like learning more and more about less and less. Like you go deeper, not wider,
pretty
in some
much.
ways.
Yeah.
Is that a fair statement? And then DNP versus PhD. Like, can you talk about why you chose a PhD versus a DNP and pros and cons to both routes?
Hmm. Yeah. Okay. I don't know the major intricacies of the DMP, but I do know that it's more focused on like implementation science. Like there's a
Mhm,
lot of like nurses who work in the hospitals who work on
mhm,
like quality improvement projects, um,
mhm,
like sort of like bringing evidence into practice,
mhm,
doctors or nursing practice. So
mhm,
I feel like something I've noticed sort of like in the field is there's a lot of interest, emphasis on sort of, you know, decreasing the lag time between discovery and implementation into like
mhm,
real life. And DMPs, I feel like are like the best suited for that, where they
mhm,
are able to, at least like, the ones that I'm familiar here in the program that's here is really geared towards helping hospitals like really bring evidence like right
mhm,
into the bedside, helping clinical nurses, answer
mhm,
questions that they want to investigate. Um, and so, yeah, I think that's it sort of is like if you want to be more so like practice focused and like
mhm,
bring evidence into practice and you sort of want to be like you're mostly in practice side, but you're bringing evidence there, then
Mhm.
that's more DNP. If you want to be generating evidence to put out into the world, then more PhD land,
Mhm.
I would say.
And the PhD generally takes longer in most cases. I mean, how long are you planning on being in school?
Planning on being here no more than 4 years.
Okay. And you have to do a dissertation as well.
Yeah.
Yeah, which is most DNP programs usually do projects is typically as a capstone versus dissertation is my understanding.
Yes. They I think they have dissertations too, but
Okay.
they are sort of a different genre of a
Okay.
dissertation, I guess. Yeah.
Someone will correct me in the comments, I hope. And
I'm gonna
speaking of
look this up after.
okay, and speaking of comments, throw your questions in the comments and we'll get to them in a few minutes here with Taylor. I'm wondering also, it feels like, we have this list of questions that goes back, for the 5 years now. I think we've been doing these interviews, and it's just interesting to even look at the questions and see how the field has changed from when we wrote the questions. And one of the things that I think we worried more about 5 years ago was stigma. And, was it dangerous for your career? Were you worried about, the board of nursing looking at your interest in psychedelics? And, did that ever hold you back? And how did did people ever respond to you weirdly because you're interested in psychedelics? And how did you, so let's start with that. Did you ever encounter any sort of hiccups? And if so, how'd you deal with them?
I feel like I definitely sort of like kept it to myself for a while because I just like wasn't sure. Because to your point, yeah, like it's like, well, if you know that there's stigma, it's sort of like, well, how do you like I don't want to test it out, and and bring up this book that I'm reading or whatever. But I think I've been really fortunate to be, in different, in the different units I've worked on, the sort of like, I feel like I've been surrounded by coworkers that are just so open and non-judgmental. So I feel like in certain spheres, I would like, in like, my, fellow nurses on the Johns Hopkins Children's Center, like my colleagues now at the Children's Hospital of Philadelphia, there's sort of this climate of like openness and curiosity and sort of giving each other the benefit of the doubt, where it's not like, well, why are you saying that? Like it sort of is, people bringing up different things. I mean, maintaining professionalism, of course, but even just expressing your interest in something, like psychedelics, like that has been okay. But I definitely think it's been, it's definitely been interesting. Like honestly, even like being my PhD now, where different, responses to this. So I think right now a lot of people are like, oh wow, that's like really interesting. Like, what a topic. But I definitely, as I'm looking for like different grants to apply to or different, journals, like, oh, do you know if they would be into that? That's kind of a taboo topic. How are you gonna address the risks, appropriately? Like, I feel like that's always the feedback I get on like, on sort of materials. So it seems like right now it's okay to, at least in my experience, it's been okay to talk about it, but so long as it's like, like the first question I always get is like, well, have you thought about the risks? Like, and, but it hasn't really been like onto me personally.
And nursing tends to be pretty apprehensive. Has been I'm curious what your thoughts are about this, because you're wading into even more, maybe even more challenging waters by your interest in sort of psychedelics and pediatrics. But like, I was co-author on the first article in AJN in 57 years in psychedelics, and like this is in like 2021, and you would have thought that we were talking about something really wildly controversial. And I remember explaining to the editors, like, this research has actually been going on for like, this current bout of research has been going on for like 25 years, and before that there was like 27 years of research into this, between discovery and prohibition. And so this isn't really new, but, I think nursing often tends to be, we have this struggle sometimes with like, where do we want to position ourselves? We say we want to lead, but then we hold back,
Right. Yeah.
and it's like, well, which one is it?
Right. Right.
With your grad school situation, so one of the things that I know with PhDs is really important is your advisor. That they really kind of are central to your whole experience, because you're going to run all your research ideas past them, and your dissertation, which is really your ticket out of the program, and such. So were you able to find an advisor that you felt like could be supportive to your interests, and how did you do that?
I decided right out of the gate in my personal statements and in my interviews to just like let it all hang out. Like, this is what I want to research. This is where I see myself. This is how I think I align with you. Like, no, I don't want there to be any sort of like question of like, well, I didn't realize that this is what you really wanted to do, So I figured, people, if they like it, great. If they don't, then that would be really painful, honestly, to like go there and then have this sort of weird reconciliation. So yeah, I think just like putting out like, and Ohio State, obviously has this, our Center for Psychedelic Drug Research and Education. And so it hasn't been totally like out of left field to be interested in something like this, but it's definitely like in the College of Nursing, there's like, I'm really the only one who is studying this particular topic. So, but I think it's been really helpful being, I met with my advisor beforehand, just to sort of like get a better sense of her research. I like read a lot about what she was doing, and it's been really helpful, not necessarily centering myself on specifically psychedelics, but sort of like thinking about what is it that I'm really interested in. And sort of broadly, it's in mental health and in relational health in child adolescent development. So like all those things. And so it's been really helpful. Like my advisor, Dr. Susie Breitenstein, she's here at the College of Nursing. Her research is focused on early relational health and sort of like the parent's role in influencing kids' development over time. And, how do we intervene on that? And so it's been really helpful, I think, having someone who's not like specifically psychedelic focused, but is really knowledgeable about, implementation science and child development and family health and, parents, and is also really open and supportive of like, okay, this is where I'm coming from. I understand, here's your interests, and, how can I use my expertise to like leverage you, for success. So I think a lot of it is like, for anyone else out there who's like thinking about it, it's like being open to, to your advisor's research, because like ultimately they need to be able to help you somehow. And it's like, if they don't know, if you're asking them to do something that they don't know anything about, it's sort of like putting both you guys in a bad position. But being with someone who's really supportive and open to what you are interested in, and you're also sort of willing to meet them like sort of like halfway, I feel like it's like a really great sort of situation.
So did you know that she was going to be your advisor when you applied to the program? Was that something? Is that part of what drew you there?
No, I just like saw her and I was like, oh, like that'd be someone who I would be in, like I would love to be my advisor, and just wanted to like meet her and see like, oh, like, do we have a nice sort of conversation style? Because I feel like the other like half of it is just like regular being a person, like, oh, she responds to my emails and like, it's really asks me really good questions, and it's like just like seems really friendly. So
but I think one of the things I'm hearing in your description of a PhD program is that it's a lot more self-directed than maybe other nursing education might be, where even in like an NP program, there's this curriculum, and like you got to check this box and do this thing and learn this thing, and then if you succeed in doing all those, you you become a nurse practitioner, you get that degree and you can do that. Whereas this is really much more like you got to decide what you're interested in and then find people that will help you understand that better and then design questions that serve that interest, right?
Totally. Yeah, this is not an autopilot zone. Like I feel like you have to listen to yourself, know yourself. It's like you're very much like on your own little, not that you're like alone, but like it's sort of is like you are the captain of your own situation.
Right. So it's not the kind of thing where it's not the kind of place where you show up and you're like, just tell me what to do and I'll do it and I'll pass, right?
They'll be like, I feel like every time I've been like that, they're like, well, if you can justify it, you can do it. It's like, well, I would just know.
Yeah, I've heard it described as kind of entrepreneurial in a way that like if you have an idea and you can figure out how to study it and how to get money to pay for your research, then go to it,
Yeah. No, I feel like it's exactly like that.
Yeah. But it sounds like it's also this aspect of like finding allies and finding people that may be thinking about your topic more broadly than you originally thought about, or thinking about it in a different way than you originally thought about it.
Yeah. I feel like the relationships that you build, like when you really like put out into the world what you want and what you're interested in, like the people I feel like who have come into like my orbit have been like, I'm like really interested in that too. And that's been, I think, really helpful. And also I feel like just people like generally like want to help you too. So if you're like, hey, like, like I remember like asking you about like a fellowship at one point, and you're like, yeah, like this is what it's about. Like, so I feel like throughout the way the relationships, the people are like, yeah, I would help you with your mission.
Yeah, and fortune favors the bold, right? So if you what's that saying? You miss 100% of the shots you don't take, right? So
Andrew
no, that's not me. That's like Yogi Berra or something. But like the idea that like I think a lot of people are intimidated by somebody who is known in their field or whatever. But a lot of academics, like, we're kind of nerds. We're excited that somebody is excited in what we're excited about, and we'll like nerd out about it for half an hour on the phone or something. So it's not uncommon that like if you see there's somebody out there researching stuff you're interested in, if you reach out to them, there's a reasonably good chance they'll get back to you. There's a question here about well, I think you've answered this, but if there's anything you wanted to tack onto this, but I also wanted to ask you about the psychedelic parenthood thing that's in your bio. So your dealer's choice, whichever one you want to speak to.
Okay, so that question was
what advice would you have for a nurse interested in psychedelics, and then also want to know about the parenthood program.
Okay, do that one first, and then the psychedelic parenthood. I guess any advice for a researcher, like someone who's interested in that?
Yeah, and there's kind of a related question here of like, do you think that nurses need an advanced degree to get involved in psychedelic research and nursing? You already had one, and then you're going and getting another one. So is that necessary?
So I don't think you need to like actually get your PhD to be like involved in research. Like for example, in a lot of clinical trials, nurses are involved in the administering and monitoring of patients. Like I know that Yale is working on like a whole program dedicated to developing nurses to be involved in clinical trials with psychedelics, with implementation, in the regular world of psychedelics. And so you can be a nurse and be involved in that for sure. You'll probably need some additional, you'll definitely need some additional training, like on, how to facilitate, psychedelic assisted therapy. What do clinical trials look like? But yeah, you do not need to go get your PhD to do that. And if anything, you'd be overqualified if you did that. And then you're like, I actually just want to just be a session sort of facilitator. They'll be like, we don't pay for it.
Yeah.
But
yeah, I think it helps to kind of define what people mean when they say, I want to work on research. It's like, okay, that means, it's sort of like saying like, I want to work in healthcare. It's like, well, there's lots of different ways you could do that,
Huge jungle. Yeah.
And I think a lot of times when people think about somebody in research, they think about the person who's like on the stage at the conference, or they're the first name on the paper or whatever, and that's definitely sort of like the high profile thing. But like, I work on research studies, and I'm often like the medical monitor, or I've been the therapist in the room, like today I just did a whole bunch of screenings for the study I'm working on, because somebody licensed has to do that. So, those are the kind of, it's not sexy, but it's research,
But it's research.
all, and it all needs to get done, in order to make these studies happen.
Yeah. I remember like looking up, like when I was in that high school biology class, like, oh, wow, being a scientist looks really cool, being a researcher. And then I looked up like what that looked like, and I'm like, that looks so boring. and so it's so unsexy. And
yeah, nothing like an IRB meeting or something, right?
Yeah.
Yeah. My kiddo has a friend who was like a tuberculosis researcher, and when she was younger, or she said, my dad is a scientist. He writes grants. Like that was her idea of what being a scientist was.
Don't
like.
Bring him to career day.
Yeah, trying to get funding, for your studies to keep your lab going. And so that's the less sexy part of it. Can you tell us about this Psychedelic Parenthood organization that's in your bio?
Yeah. So yeah, it's a Psychedelic Parenthood Community. It's a sort of like global community that's dedicated to connecting parents, providing education in, they have a huge, or we have a huge conference presence, just like around the experience of parents who have used psychedelics themselves, how it influences their experience of parenthood, how they parent their children, how psychedelics show up in different like family settings. And so, yeah, it's like, it's free to join if you go online. But
is there a website they would be able to find?
Psychedelic Parenthood Community. Yep. Do you want to send it, or?
I'll put it in the chat.
Okay, cool. But yeah, there is like, a monthly newsletter, there's like online forums. But really it's just sort of like a place to raise awareness of this topic that has often been, majorly stigmatized as, parents using psychedelics, but also to raise awareness that like this is something that people do, but also to, be able to connect people to share their experiences, to learn more about, how do I talk to my kids about this, eventually one day. How has this impacted my relationships with my children, with my family, with my partner, with my parents, whatever. So sort of like, sort of broad, it touches on like a lot of different things, but that's sort of the gist.
Nice. There's a question here from somebody who is a pediatric critical care nurse for over 10 years and will be going back to work on her PMHNP program in the fall. How can I focus my schoolwork towards getting into this area, presumably what you're doing, area of pediatric psychiatry? Any thoughts on that?
Cool. Yeah, well, congrats on, your path sounds like really interesting. And my first thought is that going into your PMHNP program, this will not be part of your coursework for sure. So you'll it would be helpful, I think, for you to look at some of the extracurriculars that are available to you, depending where you're going. I know at Penn, we have a psychedelics course that is available to nurses. A lot of times it'll be sort of like, I know in different programs, it might be sort of like brought into like palliative care, or more like holistic nursing, entheogenic nursing, whatever. So, if there's opportunities for you within your program to sort of get to know the psychedelic world a little bit, that also might be nice to like, see what's available at your university, meet some other people in the area. But in terms of getting into psychedelics and pediatric psychiatry, there's not too much out there right now. You're welcome to reach out to me, and I can sort of, let you know what I find along the way. But I think, if there's a few researchers that who are doing this work, you can like, set different notifications. If they, let's say in like ResearchGate, that they publish something, then that way you can sort of be up to date on what's coming out. Like I would say, just reading things as they're coming out, because like, even doing this review, the scoping review right now, there's been just like so much more coming out over the past few years on this topic, like mostly theoretical, like what would this look like and what are some considerations, but it's been really helpful, I think, just to even know what people are thinking generally on this topic. So I feel like that would be a really good place to start, just like sort of keep your finger on the pulse of like of what people are publishing. If you're going to different conferences, you see someone speaking. I know at the Psychedelic Science Conference in Denver this past year, there's a whole panel on it. Go up and talk to people after, see who else is there. So I would say that would be the best thing right now. As things come out, like, if you're interested in being on the research side, like, I know that Andrew, as you mentioned, that there's like some interest in having these types of studies. That's something that if you see, you follow these people on LinkedIn and they're like, oh, we're planning on having this study, you can be like, is there any role that you're hiring in this? So yeah, I would say just be around the people who are doing it now, and you'll find out. Because like I'll probably just like share things that I find on like LinkedIn or whatever, and you'll be first to know.
Yeah, no, that's great advice, and just getting to know sort of who the key researchers are in a given space is really important, because there's probably, as you point out, not that many. I mean, there was a time I remember, maybe 10, 15 years ago, when it wasn't impossible to kind of know at least all the clinical research studies in psychedelics. Now I'm like, I don't know, go look on clinicaltrials.gov. I can't keep track of it all.
Right.
There's just too many things happening, which is good. That's a good problem to have, right? But it's like, but it does help to sort of know who the people are. And if you're a research nerd, you'll look at the paper and be like, oh, yep, that group, like that researcher. And,
right. Yeah. You start to get to know who's around.
And even funny little conventions that like outside of academia, people don't necessarily know, like, the first author does most of the work. The last author is the person who is kind of like most well known in that space, and that's what gives the paper like gravity and like name recognition.
Anyone.
And then the middle people, like I'm my aspiration is to be a really solid middle author. As many papers as I can, because it's like you're in the pit crew, but you're important because you're doing you're proofreading, or you're coming up with some ideas in there, but it's the first author who usually does like the big push and drafts a manuscript and all that stuff. But like
the honeydew fruit salad.
Yep. Nobody told me this stuff before I got into academia, so it was just like, it's just this unspoken code. Well, speaking of stuff that maybe we wish we knew younger, we have this kind of traditional way of wrapping up these conversations, and that is to ask, if you could go back and give your younger self a bit of advice, what would it be? Oh, sorry, I just hit the wrong button. There it is. Any thoughts on that one?
Oh, that's like such a great question.
That's why we save it for last.
Yeah. I want to use the same thing I said earlier, just like to be like chill, enjoy the ride. But like, I think just like in retrospect, there were so many times I feel like that I was like sort of like doubting like my like, oh well, someone else is going to do this, or like, or I'll be a nurse, but I'm just going to try not to make a major mistake. That I'm going to set the bar at like just making sure I don't have like a critical failure. But like, I think just like, going back in time, being like, just like, you are, you're a nurse, like that's part of your hardwiring. You're a nurse. You look for opportunities. You try to make sure these bad things don't happen. But in the meantime, listen to the things that like only you can hear. Know, like really like take to heart those questions that like keep you up at night. Don't try to like get rid of them. Like I remember watching, this is like when I was like studying for my nurse practitioner boards, I watched Frozen 2, and it was like, oh my gosh, like, I don't know if have you seen it?
A long time ago, yes.
Yeah. I was like, Elsa's getting like a little call from the woods, and it's like there's some things that are like for you in your path. They're only yours, and you don't need to wait for other people to be like, that's a great idea. In fact, a lot of people tell you it's a bad idea, and listen to like, I think what makes you really excited. Like, I was the only one of 2 people in my undergrad class of like 100 or so that was interested in psychiatry, and even still it's sort of looked at like, well, you must be crazy if you want to do that, but that just, I loved it. I love it. So yeah.
I mean, clearly you found your passion in many different ways and continue to do so. And I also hope that for people that are kind of considering this academic path, hearing what you've had to say tonight is helps refine that a little bit, because sometimes you have to go from this like aspirational idea to like, what does that actually look like?
Right.
How would I actually get there? And at the same time, as you point out, you're sort of making the path as you walk it. You can't necessarily go and say, oh, I'll take that path. It's like, maybe the path that you want to walk doesn't fully yet exist, and you're
making it.
You're making it as you go. So, but and within the framework of a very well-trodden path of like academia and doctoral work and all that. But then what exactly that path looks like is really, and sounds like from what we've heard from you tonight, is really up to you to create. And I imagine that's very inspiring to people out there who are like, do I have to wait for an invitation? It's like, nope. Yeah. Well, good. Taylor, thank you so much for being on with us tonight and for contributing to our ongoing library of, I mean, it's wild to think that 5 years ago when we were coming up with this series, we're like, who can we interview? Who do we know who's a nurse who's interested in psychedelics? And it was kind of a short list, at first, and it's like, and then it was like, oh no, we're gonna, after like 5 people, we're gonna run out. Like, it just keeps happening. So that's a good problem.
Yeah.
So thank you for sharing your wisdom and your time with us tonight, and thanks for those of you who are watching live and those who will watch down the road when this goes up on YouTube. Before we go, I just want to point out that there is we can stick it on the comments of the on the YouTube page, but we are doing on September 14th, the FDA is having a FDA and Health Resources Services Administration, HRSA, is having a hearing about, they want information from stakeholders about psychedelic implementation, because we're very likely looking at 1, maybe 2 compounds being FDA approved by the beginning of next year. So this is actually really happening, and they're like looking to people like us to give them advice about how to do that well. So Open Nurses has a letter that we have put together that we are gathering signatories for. If you want to write your own letter, you are more than welcome to do so. But I know a lot of people don't have time or expertise with that. So we've kind of done, at least a draft that you can sign on to. You're welcome to, but we'll put that in the comments so you can find that. But encourage you to do that in the next couple of weeks before that goes to the FDA. Oh, look, Wendy's already put it in the comments for us there. So we've got that. You can go on. It's just a Google form and you can add your name to it. So thanks again, Taylor. And
yes. Thank you so much for having me. Yeah. Love Open Nurses. Love you guys. Thank you so much.
Thank you. Have a good night.
You too.
Bye, everyone.